Being able to write your notes easily and quickly is one of the best ways that you can save time in general practice or any type of healthcare. And in this episode, I'm really happy to show you a product that I think can help speed up that process even more, so you can spend more time with your patients, potentially go home quicker, and make your life so much easier as we have a look at Nabla Copilot, a way that you can use AI in general practice as we tech enhance your primary care and learning. Let's get cracking, shall we? Hello, EGP learners. Welcome to this stream where I'm joined by Laurent from Team Nabla, as we're going to have a look at the new tool that they've got that's pretty awesome, if I must say so myself. I've been having a go at this for the past few weeks and stuff, and it has surprised me at how well this can do certain things, and we're going to have a look at it in a lot more detail. But just before we do that, do you want to say hi for us, Laurent?
Yeah, sure. I'm Laurent. I'm the Chief Product Officer at Nabla, and I'm so happy to join the show.
Absolutely, and we're really happy to have you here as well. I can see we've got quite a few people joining us live, so if you do have any questions and stuff, feel free to stick them in the chat. We will get to them as we go along, but we've got some really cool things to show you. So first of all, let's have a little look at, let's hear a little bit more about Nabla itself. That's probably a good place to start. Do you want to tell us about Nabla itself, Laurent?
Sure. So we co-founded this company 4 years ago out of mainly like engineers in AI and machine learning backgrounds, and so it was very important for us to actually practice care, and we are not doctors. So we decided for the first 2 years of Nabla to actually build our own digital clinic in France and in the UK. And so we had 25,000 patients that could connect on a mobile app with a team of doctors. And it was focused on women's health. And this is basically how we learned that it was not about helping doctors diagnose or symptom checkers, but it was about reducing the admin burden of the doctors. And so this is how we basically realized that we need to apply AI and machine learning to try to help doctors to be much more effective. And the first low-hanging fruit is the medical documentation, because as you said, it's so painful.
Mm-hmm. Definitely. And through that, I know that you've created this Nabla Copilot, as you call it. So tell us a little bit more about the Copilot.
So the Copilot is a Chrome extension. So I will show you what it is. So it's like a plugin that you can have on any website, or you can use on your on any browser or on your mobile phone. And this is basically like a medical scribe, except that this is an AI that will do that. So it's as if you had a blind medical scribe with you in your consultation that will take notes, and at the end of the consultation can very quickly, in a few seconds, generate a structured medical note, so that you can then just have to copy and paste it into your EMR.
Mm-hmm. And we're going to have a look at that entire process from when you start signing on to how it works and stuff in a second and things. Just important, I think worth mentioning, so this is a sponsor stream showing what Nabla can do and stuff. But I have had a go with Nabla for the past few weeks, and you are going to get my comments and stuff when we've done the demonstration. So make sure you stick around for that, and obviously the opportunity for you to ask your questions as well. Let's have a little look at it, shall we, Lawrence? So I'm just going to switch over to the screen share for us. And there we go.
All right. So I will go through the onboarding because you will see it's super easy. And by the way, you can go after on Nabla.com, and you can go and test this by yourself. It's free to sign up, and you can have up to 30 consultations for free per month. So again, feel free to use it after and tell us what you think. What I will show you is what we call the Chrome extension, so that we can do a demo with Dr. Gandhi here. And so the easiest way is to just type Chrome Nabla Copilot in your Google. And so you will go to something that is called the Chrome Web Store. It's like the App Store that you have on your phone, and that will give you a list of different plugins that you can install on your computer. So you just click on Add to Chrome here. And so you click this, and it's going there. And so it gives you a small tutorial here where you can, it's explained that now Nabla Copilot is accessible here through the extension. You can pin it, and then you can just use it by clicking on it. And that's it. So I will do the quick onboarding, but it's again, it's super simple. Let's say I'm a GP doctor. We will probably get back to the data and privacy. And I just had my email, and that's it. So that's super simple, right? You see, it's just a few steps, and now you can use Copilot on any website. So if you close this, and for instance, you go back to this video consultation that we will have here, you can see that I can click on this and open Copilot here. So that's Copilot, basically, that sits on top of any website. Here it's sitting on top of the video call that I'm having with Dr. Gandhi. And for this demo, I will switch a little bit the roles because I'm not the doctor, but I will pretend and I will fake being a doctor. And doctor, if it's okay with you, for once, you will be a patient. How does it? And so we do support video consultation, obviously, telehealth visit, but also consultation on the phone and in-person consultation. So everything that you see here, you can also do that at your practice, and it will work as well. So let's say, doctor, that you will play a patient with lower back trouble. Okay?
Okay.
All right. Hello, what's bringing you today?
So I've been having back pain for about 2 weeks now.
All right. When did it start exactly?
So it started about 2 weeks ago, and it's just been constant since then.
Okay. And have you had this before?
No, it's the first time.
First time. Any event that could have triggered this, like gardening or moving furniture?
Nothing significant, nothing more than I normally do, but I guess we have tried, been moving some things at home and things. So yeah, maybe, I guess, but nothing that I would expect would have caused it.
Okay. And out of 10, how would you rate the pain?
So when it first started, it was probably a 9 out of 10, but I have taken pain relief since, and it's probably now gone down to about 6 or 7, but it's just the fact that it's constantly there.
Okay. And what type of pain relief did you use?
I've been using paracetamol and ibuprofen.
Okay, great. And okay, and so do you? Is it better when you are lying, in your bed or when you are resting?
Definitely easier when I'm not moving or trying to shift things and stuff. And when I lie down, it's okay, but it does feel worse in the morning when I wake up as well.
Okay. Any medical histories that I should be aware of?
No, fitting well.
You're doing well. Okay. What about in your family? Do you have anything that may or may not be related to your back trouble?
No family history.
No family history, so you're perfect. But I think I remember you told me that your mother has type 2 diabetes, correct?
Oh yeah, sorry, I forgot that she has diabetes. Yeah.
All right. So what about allergies? Are you allergic to anything?
I have hay fever.
Hay fever. Okay. So you are not allergic to penicillin?
No.
All right. Okay. Since we are in telehealth visit here, it's hard for me to do a physical exam here and to know exactly what type of move you can do or not. I think you did the right thing by taking some painkillers. It's definitely helped. It appears that you have something like called a lumbago, which is very classic. Especially if this is the first time, I would not be too worried about that. What I would recommend is maybe anti-inflammatories drugs. So I would prescribe you something like this. And also something that can help is like this hot and cold compresses that you can get anywhere. Usually it's really helped with lower back trouble. So I will prescribe that as well. And I think what would be great is I would be checking on you in 2 to 3 days, and depending on how it goes, we can maybe go and investigate further with additional tests and like X-ray test or something to see whether. But I don't think there is anything broken or whatever. So let's start with this, and then we can probably see how it goes.
Okay.
Do you want to add anything?
When should I be worried about coming back if something's changed?
So I think in a few days. So let's wait for another 2 days treatment, and and then you can come in and I can do the physical exam and see if I can find something different.
Okay, thank you.
All right. Anything else?
No, that's everything. Thank you.
All right. And so that's it. So I can just click on end consultation here, and it's going to generate the medical notes. So this is a bit strange here because you probably have been focusing on the transcript and the mistake because of my accent. Actually, most clinicians and providers, they use it like this in a minimized version because you don't want to look at your screen. Actually, Copilot is here to help you be eyes to eyes with your patients. And so that's basically the purpose of this demo, is to show you that we can transcribe, which is the first step in the process, is to transcribe all the different things that are discussed during the consultation. And so that's what you saw here. The other reason, and so here is the note here. The other reason why we have a transcript is that because sometimes for some specialties, when you are doing a mental health assessment, for instance, sometimes it's very important to quote the patient. The way they say something may be very important. So imagine that this was very important. I can actually quote this part and add it to the note, right? So you saw that within a few seconds, we were able to generate a structured medical note, so we can go over very quickly. But this is the chief complaint here, the back pain for the last 2 weeks. The HPI here is started 2 weeks ago, constant pain. The score, the pain score here from 9 to 10 to 6, 7 to 10. No significant events. Worse in the morning with movement. So everything that you said basically throughout the consultation will be captured and structured into the into this note. And since you are a perfect patient, you have no significant medical history. I made you confess that you are mother at type 2 diabetes. You said that you are not allergic to fever. This is important as well. We can capture negation, which is very important in I'm not allergic to penicillin here. Your current medication that you mentioned, and my assessment, and the plan that I mentioned. Any question on this?
No, it seems very clear, and I know we've got quite a few questions coming in through the chat, and we will get to those, so don't worry, everybody. And I know Marjo is helping us answer some of those as we go along, but don't worry, we will come to those as well. I guess in terms of how the Copilot works and stuff, anything, I know there's obviously the option to send some of this data to Nabla as well if there's been questions about whether it's been effective or not, hasn't it? So I know that's something I've done a few times.
Yeah, so so that's a good question. So if you wanted to help us improve Copilot, the best way to do it is to actually rate the quality of the notes going forward. So the next step of having this note here, obviously, is to actually paste it or transfer this into your medical software. And so we have a big copy notes button here that you can press, and then you can paste it directly into your software. We are working with some integration so that it can go directly from Copilot to your medical software, but it will take a few weeks or a few months to do that. So you see here, it asked me to rate my note. I can say it was a perfect note here, and I can send this and DMO. And I have the option, you see here, to add the transcript and the notes if there is no protected health information. So in this case, it was not, so I can send this. And that's basically how physicians can help to improve the Copilot here. Make sense?
Cool. Okay. So I'm going to take away the Copilot. We'll come back to it if we need to and things. And I guess I've got some questions that I know I've already had submitted from other people that I think it'd be useful for us to cover and stuff. And then absolutely we're going to go to quite a few of these questions that we've got in the chat and stuff. So lots coming in, Laurent, so I hope you're ready for all of them. I guess in terms of some of the key questions I always ask, so in terms of onboarding time, we saw it was fairly quick and stuff, but have you come across any challenges at all when it's come to onboarding people with the Copilot itself?
No, we tried. So that was also one of the learning of doing care ourselves with doctors, is that you have like already so many hardcore software that you need like 200 clicks to make it work. So that we really decided to design this to be as simple as possible. So usually, in most of the case, you don't need any microphone. The microphone of your computer or your phone will be large enough, so you don't have to plug an hardware. And so, usually it's really down to like 20 seconds max.
Sure. And having gone through the process, you're right, I did find it quite easy. I know there's a lot of questions coming in about hardware and that kind of stuff. It may be worth you just covering what exactly equipment do the clinicians need in order to start using Nabla. Is there any particular requirements or anything like that at all?
So you will need a microphone at least. And so again, depending on the type of computer you have in your practice, whether they have a microphone or not. In some practices we visited in the UK, there were no microphones. So if this is the case, what we have done is that you can use Copilot on your phone. So you use your phone basically as a microphone. And so the beauty of the recent phones and smartphone is that they have like a very, very good microphone. And so your phone can be an extended version of a microphone. And so you can use your phone to actually generate the notes. And then there is a way to synchronize your phone with your computer and automatically share the note that was generated on your phone to your computer, so that you don't have to to send you by email the notes. It's going to be synchronized automatically, and you can get the note on your computer from a note that was generated on your phone. In most cases, your practices will have a computer with a microphone, and it's going to work without any additional hardware.
Sure. I guess for many of those out in general practice as well, remembering that the webcams that you probably have on your computers will also more often not have a built-in microphone that should work fairly effective. Only times I found it not work as well is when you've used built-in microphones in laptops and that kind of stuff, because they're not often designed for the projection type discussion you may have, definitely from yourself directly, but when you've got a patient sat in the room, that may be more different. Headsets, it seems to work amazingly. So definitely telephone consultations, that kind of stuff. Actually, that seems to work really well from my experience with using it and stuff. I guess in terms of questions we always cover, so cost, if people were interested in having a look at Nabla, I know you mentioned there was that 30 consultations a month free that people can sign up to, but how much would it cost if people wanted more access than that?
Sure, if you want unlimited access for your consultation, there is a pro plan that is $119 per month per provider. If you run a bigger practice, there is group discounts starting at 10 providers. But yeah, usually it's $119 per month per provider.
And again, one thing to mention, that's obviously dollars, not pounds, so it's slightly cheaper in the UK. I know when I've spoken to some people, they've kind of raised questions about the cost. I guess what I equate it to is how much time is that saving you, and then factoring that into, I think, the key thing. Because I know for me, it's been really time saving in a lot of the consultations that I've had with it. I guess, are there particular consultations that you found that this has not worked so well with from your experience so far?
So, in our experience so far, it works great, especially for the first, the intake consultation, the first time you see a patient. It's not that great yet on a follow-up consultation. So, assuming you have follow-up consultation with a patient with multiple problems, you just need to do what we call a progress note. So just to see the progress. Copilot is not yet great because it doesn't have any context. Remember, Copilot is this blind scribe sitting next to you, but that doesn't have any access or history or context about your patient. So even if you see Laurent for the third time in a month, Copilot will actually start from scratch at every consultation. For now, we are working on integration so that you can either directly Copilot can have some information as context, or that you can put like the previous notes as a context for Copilot to actually generate a progress note. It's going to come in the next few months, but that's the only probably case where we're not doing amazing right now. We are also working on, because we know that especially GPs, usually they have multiple problems to handle. So we are also working on different templates. You saw that the note was following chief complaints. We can change this. You have multiple templates that you can change in the settings, and we are working on a specific template that will better accommodate with problem list based or problem based template, where you would want, if the patient is here for hypertension, diabetes, and something else, and a flu, you would probably want to have your notes structured by problems instead of just objective, subjective, and plan. So that's what we have started to work on.
Okay. And you mentioned you talk about the security side of things. So I know many people are thinking when it comes to AI, they're always worried about the IT security and all that kind of stuff and things, particularly when it comes to being used with health data and in particular NHS data. Can you cover off some of the security side of things so that people are
Sure.
aware of what they're signing up
This
for?
is actually one of the very, very important points that I wanted to cover, is because, again, as you said, AI usually doesn't have a good reputation for that. We decided to go the opposite way and to actually store nothing. So we don't store any data. So we don't record the audio. We don't record the transcript, and we don't save the transcript on our servers, and we don't save the notes, the final notes, on our servers. So everything that you saw in this demo is actually only stored locally on my computer as a fake doctor. So it will only be available for you and not accessed by someone else. So that's really important. We don't store anything. The only way we can have access to your transcripts and your notes is if you use the feedback tool that I showed you in the demo, and you check this box to attach the transcript and notes. Other than that, we do process the data in order to do what we do, but we don't store anything.
And I believe with the server storage and stuff in terms of that processing, that's still in line with GDPR and obviously all the other data requirements and stuff.
Exactly. It's GDPR compliance. We are also ISO 27001 certified, which is like a big certification. SOC 2 certified as well in the US. The data doesn't obviously move for processing outside of Europe, otherwise you wouldn't be GDPR compliant. So yeah, we are pretty strict on this topic for sure.
And if people did want to check out more about digital certificates and stuff, definitely check out the episode I did with Dustin Saint from Primary Care IT, as we explain all those various different certificates, which are a real headache to understand, if I'm being honest, but absolutely covers a lot of that there for you and stuff. And the other thing I have liked about Nabla as well, when I've looked at it, so you're very transparent about the security side. It's on the website. I think you've got the full packs as well to download, because I know I specifically asked to see all of that when we started talking about the product itself. And I was quite impressed about the fact it was openly available on the website. I didn't have to go wait for you guys to send it me or anything. You just said, here's the link, have a look. It's transparent and stuff.
Yeah, if you're passionate about privacy and security, we have a blog post on our website that explains exactly what we do, all the measures that we take in order to protect the data and make sure there is we will never access to any patient information.
So I think that now's probably a good point for us to have a look at some of the questions and comments we've got from our viewers and stuff. I'm going to come back to a couple of my comments in a second, if that's all right. But I think we've got loads of stuff coming through from various other people as well. So let's have a look. And if we're talking about security, let's go with the first one that we've had. So this is from Gurpreet Rakra. Is patient consent needed before using something like this? Is it NHS approved in terms of data security? We've kind of half covered that, but the consent issue, from your perspective, Laurent, how would you deal with that?
So the patient consent is, if you look at specifically, GDPR on the law, you actually don't have to do it. Okay. In Europe, you don't have to do it. In some states in the US, you have to do it. You have to have the consent. In Europe, it's a bit different. You don't have to. What we have seen is that some providers actually wants to do that, to be 100% transparent, and they have seen like an amazing a reception from their patient. Actually, patient love to see their doctors using your technology to be able to focus on them and not typing on their computer anymore. And so it's really up to you. It's up to the provider to decide whether they need to actually ask for the patient consent. We don't have any best practices because in both ways we have seen like pros and really like a lot of pros and again amazing feedback from doctors who actually ask patient consent every time.
And I guess a couple of tips I'd mention on that. So number one, it should be on your privacy note if you're using software like this, in terms of able for patients to have a look at if they choose to. But additionally, one of the things I found easier to do is not actually start Nabla Copilot until after you've done your ID check with the patient. And often at that point, I also tell them that I'm personally, I do mention that I'm using a tool to help record the consultation for the notes. The reason why I don't start it later is purely if I did want to send the consultation off then to Nabla, I don't have the patient's name and details from the ID check within the transcript. I found that an easy way of doing things in terms of documentation and stuff as well.
The small things as well on this specific, don't say I'm starting to record the consultation, because we are technically not recording the consultation. It can really, scare the patient. You just say I'm using a tool to help me document and make a summary of this consultation, and it will change completely the perception for sure.
Okay. Next question from Dr. Martin Kruger. How could I customize and automate my notes for specific clinical fields based on speciality? Each speciality has different types of notes. And thank you very much for sharing the tech as well.
Yeah, so very good question. So in our longer term roadmap, we want to be able to allow you to customize and personalize the template, because what we realize is that each of doctors and specialty, they have their own templates. Even within the same specialty, they have their own template. Currently, you can select. We have up to 7 different templates. The default one works pretty well for a lot of specialties, but we had to create a specific one for psychology, psychiatry, even lactation consultants, cardiology. We are going to add more and more. If you don't find a template, or if you find that the template is not really suited to you, just use the feedback tool that we saw and tell us what type of section you would want, and we can add templates on Copilot.
Cool. And if any of you want to join in with my request for having the history examination diagnosis plan format, which obviously many of us use in System 1, feel free to let them know, because hopefully we'll get that pushed through sooner and stuff. But yeah, it does work quite well in terms of the sectioning off the data and things. Yeah, absolutely matching over to the way that I think we document in the UK would be nice, but hopefully that's in the plans, at least. Yeah. If I keep nudging them, I hope it is anyway.
Again, every one of you has a different style. Some of you prefer like bullet points, other paragraphs and everything. We already have these settings that you can use in Copilot. You can select your preference, your style preference here. And so more and more Copilot will adapt to your style and the way you structure your notes.
Okay. Another question from Gurpreet. So how does it deal with multiple problem consultations? Are users able to go back and edit it?
So this is what I mentioned a little bit. So currently it will basically just inside each section, it will probably mix a little bit the different problems. We are about to release, and probably next week, we will have a way that in each section, for instance, in the subjective and the objective and the assessment and plan, we could group the different part of the consultation for a specific problem. So if there was like a lot of things discussed about the diabetes and the hypertension and the high blood pressure and everything, we can group all of this under each problem. And we will be working, as I said, but it's probably going to take a month. We will be working on a template that will be grouped by problem. So each problem will have their own section. But you should try it. It works pretty well. Maybe it's going to mix up a little bit the problem, but we are working on it. This is something that we evaluate for sure.
So I must admit that that's something that it sometimes can struggle a little with, but as Laurent mentioned, the way I found that works best is trying to section off the problems as much as possible when you're trying to do the history with the patient. I appreciate that can sometimes be challenging, because obviously from the patient's perspective, it may all be combined, and it's also how you list the history as well. But I have found it worked relatively well, even when I've had consultations where there have been 4 or 5 issues in a single consultation, although thankfully that's not too frequent a thing and stuff. So another question from Gurpreet, which is an interesting one. What about local slang or dialect? Patients where I work may say diarrhea instead of diarrhea, for example.
Yeah, so we have our own speech-to-text technologies that we train on, especially the conversation that we had when we ran our own digital clinic in the UK. And so we are pretty robust to dialects and slang. By the way, we haven't tested this in the demo, but Copilot will know to filter out all the chit chat and not the the not relevant information. Again, you should test it. The feedback that we got from UK doctors said that it was working amazingly well with a strong accent. So it should be pretty good, but we can always improve, and we will be improving this spec. We support also Spanish and French, obviously, and we are going to support more and more languages. So that's also something we can do.
I must admit, I've tried it with patients who speak partial English, as well as with translator consultations, given the area I work in. Partial English, it seems to work fairly well. There's possibly a few edits I've needed to make, but not as many as I was expecting, if I'm being honest. Translator consultations also surprised me. It does work quite well, but there is a bit more error, and that obviously may be down to the fact that there is obviously multilingual consultations happening, a lot more ers, ums, and duplications as well. But again, it does give a good summary of the information from what I've found so far, and that's doing about 10 non-English speaking consultations so far, both in person and on the telephone as well. So that's just to give you a rough idea from there. We've got quite a few more questions about the data security, so I'm going to cover a couple of those, if that's all right, Laurent. So people have asked, if a clinician's using their personal phone, what are the data concerns there? A majority of practices don't have a microphone on the PC. Again, I'd remind people, webcams that many of you may have probably do have a suitable microphone in there, but I guess there was a question there about the phone itself, Laurent.
Yeah, so if this is your personal phone and you don't want it to actually, there is like a short-term history of consultation, up to 20 consultations. So Copilot will store up to your last 20 consultation locally on the phone or on your computer. This is for if you have back-to-back consultation and you don't have time to do the notes. You can do up to 20 consultation and then go back to history. There is a way to obviously clear the history. So if you're like, if you're really not at ease to have like, again, the transcript and the notes from your consultation on your personal phone, as soon as it's synchronized with your computer, you can actually delete the history, and then there is nothing that is left on your phone, and so you won't have any patient information on your phone anymore.
Okay, cool. Comment from Matt Honeyman. So great demonstration. Which organizations outside of Nabla are doing the processing of the audio to generate the transcript, and of the transcript to generate the note?
So great question. So as I said, there is two steps. There is the transcribing, so from speech, from the audio to the text. And so we use our proprietary speech to text. And for the part where you take a transcript of a consultation to generate a medical note, currently we leverage GPT-4 on Azure, so on Microsoft. So this is currently the best option in terms of accuracy and relevance, but also in terms of latency. So being able to quickly deliver this. We have also our own models on top of this, and so our plan is to over time to replace this with our own generative model. Currently, they are making some progress in open source generative model, but it's not there yet in terms of actually accuracy. But yes, our plan is to actually not depend on rely on the GPT-X, but to have our own model fine-tuned and tailored to the healthcare, which is going to be way better than this generic model like GPT-4.
Okay, thank you.
Okay.
A few questions about data. Sarah's random stuff, interesting name there. Also, if using the phone, does the phone need a good internet connection? We have practices with no 4G signal. I guess what is the minimum data requirements that people need for internet for this to work?
Yeah, that's a good point. So currently, you need a pretty good internet connection. Copilot can be resilient if you have small outage. So for instance, if I cut my Wi-Fi for like 10 seconds or 20 seconds, we can recover from this, and we have some sort of a buffer that will make it like really like not an issue for Copilot. That being said, Copilot cannot work if you have no internet access. So that's the current limitation. We are thinking about a way to actually allow you to record a consultation, so an offline mode where you could record a consultation, and as soon as you have some internet connection, then you can actually generate the transcript and the notes. It's not going to be available in next month, but probably the months after or a bit after.
Okay, cool. We've got a couple more questions to go, Laurent. If it's all right, I'm going to take the next one because it is specifically asked to me. It's a question for Dr. Gandhi. In real life NHS use, how does this compare to dictation software that writes directly to EMIS and System 1? So I think I'm going to give kind of my comments as well with this in terms of what I've kind of found with the whole platform and things. Number one is that I think it works really well from my perspective, and it surprised me how much better it worked than I thought it was going to do, if I'm being absolutely honest, and things. I think having good data is important. The actual time to create the notes from when you finish the consultation and stuff, it varies from about 10 to 15 seconds, I found, depending on the length of the consultation. Obviously, that has an impact. And also, as Laurent mentioned, your data. So at times, my practice data is awful, so it can take a bit longer when that happens. But it does provide a really good summary of the consultation, to the point where I've had 25, 30-minute consultations with patients, and it has captured almost everything I talked about with the patient in a summary form, which I felt I'd then be able to copy into the notes. I have had to add stuff for most of the consultations. That maybe is just my own personal preference. I know from a safety netting perspective, I often add a little bit more information because I feel that I would like more detail when it comes to the safety netting side of things. And I think important to recognize this at the moment doesn't code to any of the clinical systems. As Laurent mentioned, it's not integrated in that way that allows the coding to happen. So there is still that element of work that needs to be done from the clinician's perspective. But it has made a difference, if I'm being absolutely honest, a significant difference, and particularly those longer consultations where you then sit afterwards thinking about what have I been thinking about, and what do I need to document and stuff. Because I'm actively doing some of those steps whilst I'm waiting for the Nabla to process and form the summary, I then add that in and then add the extra bits. I found you cut down my consultation documentation time for those larger consultations by almost 50 to 70%, depending on which, how complex they've been and that kind of stuff. Shorter ones a little bit less, but then important to recognize that I type pretty quickly. If you compare that to dictation models, I think it comes down to how quickly you speak and process that as well. But I must admit, I found it similar, if not quicker. And the real benefit is the fact that it does summarize the information. It's not just copying over information. I found that a real difference maker for me personally. I don't know what you think on those comments, Laurent. More than happy to hear what you're thinking from there.
No, I think you're absolutely spot on here. The only thing that I can say is that it's a difference in paradigm. Dictation, you have been used to this, but it requires you to do that offline when the patient is not here, and to actually remember everything, trying to structure this in your head, and then start to dictate. Here it's basically the Copilot will work while you are doing the consultation, and at the end of consultation, very quickly you can get a note. If it's not perfect, you can still dictate some changes. I haven't showed that, but in Copilot, there is a way to dictate. In each section, you can dictate if we missed a few things. So you can also dictate to edit the note generated by Copilot if you want to go very quickly. But I think you will see that it's a completely different paradigm. You started to forget about the mental burden of having to document and dictate everything in a structured way.
Definitely. And I think one other thing I'd mentioned, so on occasion I've had difficulty accessing the Chrome extension of Copilot. I think that's down to individual IT providers. The actual website for Copilot works perfectly well though as well. So one of the ways I've got around that sometimes when the IT has been a bit funny about it is just logging into the Copilot website, and it works perfectly well from that point of view as well. The Chrome extension is quicker to use, as in just dialing in, but you still have that option of using that method as well if your local IT department for some reason are blocking the Chrome extension and stuff. And I know I had to have Laurent help me on board the first time, few times with that, just because our local IT department had done some changes that prevented that and stuff and things. So last question I'm going to give to you, Laurent, because it keeps coming back up and stuff, but people are asking about basically a trial of it. So I'm loving the idea. Have you got a taster for 3 to 7 days? If it saves time, I'll subscribe and stuff. Other people asking basically the same question. So yeah, how can people use it and where would they go?
If they want to use it, they go on the website, Nabla.com. Okay, and then you will see there is a big button. You can either install the Chrome extension or just go to copilot.nabla.com. This is a website. And then I bet that within 20 seconds, you can start to test it. If you're not comfortable, you can test it, do a fake patient with your friends or relatives. And then as soon as you will test it, I'm pretty sure you will want to test it in a real consultation with real patients.
Mm-hmm. Cool. Thank you for that. So thank you everybody for joining us for this session. As you said, if you do want to check out Nabla, do have a look at some of the content that's there and stuff for you to have a look at it. Alternatively, you're more than welcome to check out some of the other content that I've got that comes up around about here right now that tells you more about tools that may help you in general practice. As always, we're here to help take and enhance your primary care and learning, and we will catch you in the next episode.